Record high na naman ang nadagdag na bilang sa COVID-19 cases ngayong araw. Sa Metro
President Mojica has declared a lockdown of the capital Metro Manila.
Bawal lumabas ng bahay ang mga residente maliban sa frontliners tulad ng health workers, mga sundalo.
COVID-19 is an infectious disease caused by a new strain of coronavirus. This new virus is unknown before the outbreak began in Wuhan, China in December 2019. This virus caused a lot of difficulties all over the world and now defined as a global health crisis and pandemic.
Because of COVID-19, a lot of our fellow Filipinos lost their jobs and businesses. But despite the situation, we can see that the unity and the power of helping one another encourage us to stand again and to continue our fight to COVID-19 with the help of our beloved frontliners. In this time of pandemic caused by COVID-19, our frontliners became our modern-day heroes in our generation today because of their dedication to their work and the sacrifices to fulfill their assigned duties. Being a frontliner is not easy because every day they need to face the fear of getting sick and infected. Also, they are prone to discrimination of being tested COVID-19 positive. They experience hardship in leading and making people understand the situation and rules that needs to be followed and many more. But to further understand the life of being a frontliner, we conduct an interview with selected frontliners to be able to know their experiences, the stories that they can share, and life lessons that will help to inspire other people.
Magandang araw po, ma'am. Maaari niyo po bang ipakilala ang sarili?
I am Apprentice Seaman Ceralde Capilio, an enlisted personnel of Philippine Navy.
Meron lang po kaming mga ilang katanungan po sa inyo. Unang tanong po, ano po ang kaibahan ng pagiging frontliner niyo po noon kumpara po ngayon na umaharap po tayo sa COVID-19?
Dati kasi, office personnel lang talaga kami. Kumbaga ngayon dahil sa COVID-19, nadagdagan yung responsibilidad namin na nadi-dispatch kami sa iba't ibang lugar. Katulad sa Marikina, Cavite, ganun.
Ang pangalawang tanong ko po, ma'am, ano pong mga naging preparasyon ang ginawa niyo para po maprotektahan ang inyong sarili laban po sa COVID-19?
Bago pa umusbong ang COVID-19, tuloy-tuloy naman yung papakondisyon namin sa katawan namin, yung parating erbisyo, ganyan, kain ng sustansyang gulay, tsaka prutas, at lalo na yung vitamina. Kasi yun yung nakakatulong talaga sa physical fit ng isang tao, diba? At naging malaking bagay o tulong siya ngayon dahil nga para din maprotektahan namin yung sarili namin. Kasi diba, kami din yung nagiging yung term na frontliner para makapagserbisyo kami sa mga tao.
Pangatlong tanong ko po, ma'am, gaano po kahirap maging isang frontliner ngayong nakaharap po tayo sa pandemya dulot ng COVID-19? Maaari niyo po bang ibahagi ito sa amin?
Noon pa man, risky na talaga yung trabaho namin. Lalo pat ngayon na may COVID, mas naging risky dahil hindi nga natin nakikita yung, katulad na lang, na hindi na natin nakikita yung kalaban natin, ganyan, kasi nga diba virus. Example na lang, kami yung na-assign sa checkpoint, ganyan. Kumbaga, bago sila makalagpas sa isang boundary na lugar, kakausapin pa namin, hindi namin alam kung carrier ba ito, kung may virus na ba siya or wala.
Ika-apat na tanong po, ano po ang naging motivation nyo para magpatuloy po sa trabaho sa kabila po ng hirap na pinagdadaanan nyo bilang isang frontliner?
Siyempre, mahal ko yung bayan ko. Pagpapatuloy ko yung pagsiservisyo ko sa bayan. At dagdag pa yung pamilya ko na lagi nandyan. At sila yung nagiging inspirasyon ko. para mas maging matibay yung loob ko at maibigay ko yung tamang serbisyo para sa bayan.
Ang huling katanungan ko po ma'am ay, ano po ang mga bagay na natutunan nyo sa pagiging frontliner at paano nyo po ito gagamitin o i-apply sa pang-araw-araw?
Sa amin kasi, sanay naman kami sa hirap eh. Kumbaga, ngayon dahil sa COVID, ang natutunan ko ay bigyan importansya yung kalusugan natin. Pagkain ng masustansya, pag-exercise ng kahit thrice a week, mag-exercise kayo, ganyan. Kasi malaking bagay siya eh, para maiwasan natin yung COVID. At syempre yung vitamins, malaking bagay talaga yun. At panalangin sa Micah C.
Maraming salamat po ma'am sa pagpapaunlak po at pagbibigay sa amin ng oras.
Po namin tanongin ng inyong pangalan.
Pwede. Aldrin.
Ano po yung trabaho niyo?
Ito, tricycle driver.
Ilang taon na po kayo?
50.
Dahil po naapektuhan po kayo dahil sa COVID, ano po yung mga preparasyon ang ginawa mo para maprotektahan ng iyong sarili laban sa COVID-19?
Nakaraang pandemya.
Opo.
Hanggang ngayon Yun, yung mga sa babala sa mga TV, maghugas ng kamay, social distancing, 1 meter, lagi naka-face mask, face shield. Yun, saka hindi naglalabas kung hindi kinakailangan.
Gaano po kahirap yung trabaho nyo bilang frontliner sa panahon po ng pandemya?
Mahirap kasi ang dahil pasaway. Nabalabas, may senior pa, walang quarantine pass, gano'n.
Ano po yung motivation nyo para ipagpatuloy po yung trabaho nyo sa kabila po ng nararanasan nyo?
Anong trabaho?
Ito po.
Wala walang magagawa kailangan kumita. Kahit mahina ang biyahe. Talagang apektado yung biyahe namin.
Magkano po yung kinikita nyo noon bago po magka-pandemya?
Nung dati, lakpas 500.
Sa ngayon po?
Ako, pahirapan. Kasama na boundary, hindi pa ako maka 300. Dati, labas na yon lahat. 500 may higit ka pa uwi.
Mahirap po talaga.
Ngayon, wala.
Good day to everyone. My name is Erica Joy P. Mojica and ngayon po ay share ko po sa inyo yung naging conversation ko sa isang frontliner. Unfortunately, hindi po ako nagkaroon ng pagkakataon na magkaroon ng isang face-to-face at isang personal na pagtatanong sa isang frontliner. Kaya ang ginawa ko na lang po ay through Facebook chat. So I have a piece of paper po dito na pinarin ko na lang po dito yung screenshots ng aming conversation. Ngayon po ay ikikwento ko na lamang po ang naging conversation ko sa isang sundalo. Siya po ay si J. Mark Kinikini ng Philippine Navy at siya po ay isang frontliner. So, ang una ko po naging question ay first thing first, syempre, kinamusta ko siya bilang isang frontliner. So, yun po, ang sabi niya po doon ay okay lang siya, pero yun lamang at hindi siya makauwi dahil wala pa siyang swab test. Nasa batalyon siya ngayon, pero before ay na-assign siya sa San Pedro, Laguna, Marikina, Ayala, at Naiya. So, after nun, tinanong ko po siya sa mga experiences niya dun sa duty niya. So, ang naging sagot niya po ay mahirap kasi madaming matigas ang ulo. Kahit naaawa ako ay hindi ko pinagbibigyan dumaan kung wala silang fit to travel at medical certificate. So, ang next question ko po ay, ano-ano ang mga naisakripisyo niya para makapaglingkod? So, ang naging answer niya naman po doon ay naranasan niyang malipasan ng gutom at hanggang ngayon, di pa rin ako nakakauwi simula April pa. So, April, May, June, July, August, September, October. So, kalahating taon na po siyang hindi nakakauwi sa kanila. So, after nun, kung i-rate niya from 1 to 10, 1 as the least and 10 as the highest, gaano kahirap maging isang frontliner? So, ang sagot niya ay 10 syempre kasi lahat nakataya na pag frontliner ka. For our next question po, ang naging tanong ko ay, kung may naging advantage man ang COVID-19, ano sa tingin mo iyon? At ang naging sagot niya po ay, nalaman natin na may mabubuting tao pa din na handang tumulong. Sa kabilang banda, ano naman kaya sa tingin mo ang pinaka naging masamang epekto ng COVID-19? Ang sagot niya po doon ay, nakapagdulot ito ng sakit at madaming nasawi ng dahil sa kanya. Next, dahil nag-e-exist pa rin ang virus na ito, ano ang nananatiling motivation mo para magpatuloy para sa paglilingkod? So, ang naging sagot niya po ay, iniisip ko na lang na nakatutulong ako sa ganitong paraan, kaya nagiging matatag ako sa paglilingkod. So, sa last part po ay binigyan ko po siya ng chance na makapag-share na gusto niyang sabihin para sa ating lahat na nagtatry na lutasan o masugpo ang mga problema na dulot ng COVID-19. At ang naging sagot niya lamang po doon ay simpleng-simple, makinig at mag-ingat at higit sa lahat ay manalangin sa ating Panginoon. So, dito na po nagtatapos ang aming pag-uusap at yun na din po ang katapusan ng aking sharing. Maraming salamat po sa inyong pakikinig.
Hi, I'm Hershee M, 30 years old, and I'm a barangay health nurse, and I'm a frontliner.
How is a typical day now different from before the virus outbreak?
Okay, my typical day differs a lot from before the outbreak since before the outbreak, I am worry-free. So I don't think that whenever I go home, I catch a disease or whatever bacteria or viruses from the environment. But now it is a very challenging situation that every day I know that I must come home COVID-free, and I always think not to catch the disease from my workplace.
What are the preparation you do to protect yourself from COVID-19?
Okay, so there are a lot of preparations that I do, like for my typical day at workplace. So whenever I go outside the house, I always wear my mask and face shield at all times because I know that I have to protect myself and also the well-beingness of the patients that I handle. I always wear mask and face shield and bring all the new normal essentials like the alcohol, gloves, extra masks, and extra face shields. I always bring them with me so that I feel protected.
How hard is the job of being a frontliner during this pandemic? Can you share your experience to us?
Yes. Okay, so being a frontliner, particularly as a nurse, it is a very fulfilling and very rewarding job whenever you feel that you are able to help a patient. But at this point, there are a lot of challenges that we encounter, such as like discrimination with the frontliners. But I don't think that it would help at this time.
What is your motivation to continue your job despite the hardship you go through as a frontliner?
My motivation that I think of every day is the health and well-beingness of myself, my family, and also the community. So I know working hand in hand through cooperation and following the health guidelines, I know that soon we will be COVID-free.
What are the lessons that you learned and realization that you can share while working as a frontliner, and how will you apply it to your everyday life?
This is just simple. The lesson that taught me from this all outbreak, this COVID-19, is do not be selfish. I just need to be passionate with my work and dedication. So I apply it with everything in my work, at my workplace. So I always give 100% of my efforts to all the patients that I could help.
Good evening, Dr. Akili. Here is our question. For question number 1, how is a typical day now different from before the virus outbreak?
There is not much different except for the face shield, the face mask, and the extra precautions.
And for the second question, what are the preparations you do to protect yourself from COVID-19?
Follow the protocol of the DOH with regards to the PPEs, the donning, the doffing of PPEs, and as much as possible, minimize contacts with physical contacts with patients.
Next is, how hard is the job for being a frontliner during this time of pandemic? Can you share your experience to us?
There is not much difficulty since we've been a frontliner ever since. No? It's not only for the COVID now, but we are frontliners also for other infectious diseases, like, for example, previously we have the H1N1 outbreak, we have the chikungunya outbreak, we also have the day-to-day interactions with drug-resistant tuberculosis patients.
For question number 4, what is your motivation to continue your job despite the hardships you encounter as a frontliner?
Motivation? First and foremost, it is our duty as doctors. We have taken an oath, an Hippocratic oath, as doctors. Pandemics, regular day-to-day interactions with patients, and also as motivations, the monetary concerns for your family.
For the last question, what are the lessons that you learned and realizations that you can share when you're working as a frontliner? And how will you apply it to your everyday life?
Realizations that life is too short. We have to live life in accordance with the will of God, and whatever we do, whatever our success may be, we should do it in the name of and for the greater glory of God.
Thank you for your time.